like this, or do you want one of us over there with Lexi?
Are you good with us sitting like this?
Oh, I can help too.
I'm alone over here.
I know.
I'll go sit
Okay,
there.
yeah, you go sit with Lexi.
Yeah,
Okay. That way she's in.
So I'll give you like a little wave if it's 10 minutes, you're not anywhere close to getting on the downside. That one was perfect. We hit that one. Timing perfectly.
Hey. Alrighty. Can someone check it? Cassandra,
Yeah.
that's recording.
Like a PowerPoint.
Oh,
Should like be able to focus that.
It does put 4 though. I mean, it's acting like one.
Fuzzywigs had a significant sales increase last night.
Oh, did they?
I'm pretty sure everybody went by Fuzzywigs and got candy.
What is Fuzzywigs?
Is that a
Just like this little candy shop in Easton.
I've
Or
never
that's why they're always
She
so
might have,
like you
I
come
mean,
in.
by letter, did you get it from
Yeah.
another one?
No.
Okay.
That's funny.
Let me.
What the heck? Where did you get this?
At our meeting.
That's
in
The May
amazing.
meeting. Or September meeting.
Okay, I'm gonna start.
We're ready.
So good morning. My name is Violeta Nieves. I am your new Similac representative for your office. I know I haven't had the opportunity to meet everybody, so if you could please go around the room and just say your name and your role in the office.
My name is Beatrice, and I'm a nutrition consultant.
Okay.
My name is Lexi, and I'm a nurse in the office.
Okay.
I'm Dr. Hawes, I'm a doctor.
I'm Jen, and I'm just here for free lunch.
Okay. Thank you for coming.
I'm Cassandra, and I'm also a doctor in the office.
Okay.
Hi, I'm Brad, and I'm a nurse.
Okay.
He's
All right.
there.
Well, nice to meet you all.
Need that.
I'm going to be stopping in the office a couple times a month and making sure that I can help out with your infant formula recommendations and see how you're doing with samples as well. So today I wanted to talk about and learn a little bit more about your protocol in regards to either severe or tolerance issues that you see here in the office. And so I'm going to play a little bit of a game really quick. And so each of these colored M&Ms resemble one of our formulas. They're kind of really close to the color of our Similac product. And so with that in mind, whenever you answer a question also in this presentation, you get to draw an M&M, but they have, I have a point system. So whoever gets the most points at the end gets to win a $5 Starbucks card. But the catch, it doesn't end there. In order to get the gift card, you have to say something about each product that you would share with mom. So kind of learn about the differences about the product. Okay? All right. So who knows what the green one stands for? Color green. Yes.
Is it lutein?
Similac organic. Similac organic.
It can be organic, but in terms of our mild tolerance formula.
Oh, spit up.
Yes, spit up. So I'll give you a color.
Can I
Okay,
eat these or do I have to hold them?
and so I'll put the point systems in a little
Can
bit.
she
just
eat 'em?
Because if not, we'll be cheating. All right. And so what about the light pink? This one's a little bit on the harder side.
That's like pink or purple?
It's light pink. Ooh.
Light pink, like soy?
Little comfort? Yes.
Okay.
I'll go around the room in a little bit. And then what about this one? This one's a little bit on the harder side.
Brad, just yell it out, man.
Element?
What about the orange?
Sensitive.
Yes. And then
I'm winning.
this one.
Soy.
Soy.
Yeah.
Exactly. I'm gonna put the point system up really quick.
I think Jen won.
I'm actually the Pete specialty
They
rep.
would let me know what the product is.
Mama wants that gift card.
And we got 1 point. All right. And so, how often do you see like mild tolerance here in the office? Like, what are your most common tolerance issues that you see?
I got you, Dr.
Oh, well, I mean, it's, it's like the fussiness, speed up, thank you. My baby's got gas, they're crying, run-of-the-mill stuff.
Okay. And so, what are you currently recommending for those tolerance issues that you mentioned?
I usually just insist that they continue breastfeeding. Breast is best.
I agree with that. As a registered dietitian myself, and with Similac, we think that breast milk is the gold standard. But what about for those moms that can't breastfeed or they think their supply is low? Then I'm here to show you why our products are closest to that of breast milk in regards to the nutrient And so, more than 70% of the moms perceive either a real or a perceived feeding issue with their infant. And the nurses out here, can you kind of tell me why you get a lot of the phone calls? What does it relate to in terms of the concerned mother?
Yeah, I think it's spitting up is the most, for sure. Moms think that if baby's spitting up, something's definitely wrong.
Okay. All right. So this is a market survey, and so the 3 most common concerns were spit up, fussiness, and gas. And so here I am here to kind of like show you the benefits of our product and why we believe that after making that switch from the term to the mild tolerance formula, that it would work best for the infant at the first time of switching. Okay, and so when evaluating the tolerance symptoms to determine the appropriate strategies. So the symptoms on the left are more of a lower level of concern, and then symptoms on the right, it would be more of the higher level of concern. And so ultimately, it's important to control those symptoms to help optimize the baby's growth and development. And so, as I mentioned, Similac has you covered in regards to those tolerance concerns for the mother, yourself, and those infants. And we have our mild tolerance product line, which you all knew, it was the orange formula. And so that's for fussiness, gas, and spit up. So can someone name out what they would tell to mom when handing this specific product to mom? What else would you let her know about the product?
I don't know.
For which one?
For the mild tolerance.
Well, it looks like it's for fussiness and gas.
So you would share that with mom? Let her know that it's gonna help her baby?
Yeah, I mean, that's what it's on the thing, so I would totally just share that with mom when she's coming in with fussiness and gas symptoms.
Okay, all right,
That's gonna
doctor.
work.
Thank you. And so the other product is our Similac Elementum. So this is for more of the severe tolerance issues, such as those protein allergies, protein sensitivity, and even colicky symptoms due to protein sensitivity. And so Similac is setting their standard really high in infant nutrition, and our Similac Sensitive has 4 unique features. And so this is our unique dual carbohydrate blend. It does not contain any palmolene oil. It has prebiotics like that in the breast milk, and Optigrow, which I discussed last time I was in here. And I'm going to go over these more in depth in the later slides. And for our Similac Elementum, we also have the dual carbohydrate blend. We don't have any palmolene oil in our formulas, and it's an extensively hydrolyzed protein like that. It has casein in it, and also the benefits of eye and brain development, which are DHA and ARA. What I like about our products, and I truly believe that these products are the best choice next to breast milk, is that our formulas are clinically studied. And so they're clinically shown to be well tolerated in these infants. And so many infant formulas have only one carbohydrate source. So what does this mean? There's only one pathway that gets absorbed by this carbohydrate. And so a single pathway can lead to undigested carbohydrates left in the intestines, which can get fermented and cause irritation in the infant's tummy. And so we use all of our mild tolerance formulas contain this dual carbohydrate blend that ultimately uses 2 different sources of carbohydrate that leads to 2 different pathways which this carbohydrate can get absorbed, maximizing that carbohydrate absorption and reducing that gas and cramping and loose stool. Were you aware of that? Anyone aware of that? No, it is very interesting though that all of our product lines can definitely help out with that. And so this kind of breaks it down a little bit more. These are the 2 different sources of carbohydrate that our formulas use, the corn syrup and the sucrose. And so here you can see that the absorption of 2 carbohydrates is greater than the absorption of either carbohydrate alone. And so here you can see the absorption of micrograms per centimeter per minute, and that's higher, meaning there's going to be less carbohydrate left in the intestines. All right, so does anyone know what palmolene oil is?
Yeah, I've heard that it's in chips. They had like palmolene oil chips before.
Yes, and do you know why they removed them from the market?
Yeah, I heard that people are having really issues with them.
Yeah, exactly. So many infant formulas do contain palmolene oil. And it's a predominant source of fat. It tries to resemble the palmitic acid, which is found in breast milk, although it does not behave the same way. With Similac, as I told you, we do not contain any palmolene oil. So can someone read the first circle?
Increase fat and or calcium absorption.
Yes. The second?
Increase bone mass.
Yes. And then the third?
Promote softer stools.
Yes. So that's what our formulas have clinically shown to do. Alright. And so when a product does not contain any palmolene oil, it promotes that excellent calcium and fat absorption in softer stools. So here there was a head-to-head study by an independent researcher that looked at Similac versus Enfamil's calcium and fat absorption. And so they were both clinically significant, and there was 53 more calcium absorption in the Similac products compared to the competitive product.
Wow.
Yeah, big difference, right?
Calcium is so important. I can't believe this.
Yes.
It's crazy for me.
How important would you think it would mean to mom knowing that her infant is not getting any palmolene oil in its fat blend?
That's huge for mom. I think she would really care if her baby's bones are developing and growing the way they should be.
Yes, exactly. You have something to add?
I said I agree.
You agree?
He's my nurse, so he agrees with me.
I'm just gonna stick by her
All
side.
right, and just to make sure you're counting your numbers with your M&Ms if
I'm
you want to
so
play the
hungry.
game. All right, well if you want, you could definitely start counting if you want to.
Okay.
And there will be M&Ms for you to eat.
She didn't specify that.
All right. So this is what I like. So lactation consultant. There is many prebiotics found in breast milk, correct? And so we are one of the only infant formula companies that add the prebiotics. Can you kind of explain what prebiotics are?
Food for the good bacteria.
Exactly. So we add our galacto-oleosaccharides, which is our prebiotic in our formula. And so this, as she mentioned, it helps support the immune system of the infant and also helps soften those stools of the baby to make them closer to breast milk. And so our mild tolerance formulas have the Optigrow, and so I discussed the benefits with you last time I was here. And those are for brain and eye nourishing nutrients, the DHA, the lutein, and the vitamin E. All right, and so why recommend Similac Sensitive? It is the #1 solution to address most common tolerance issues. And it's the #1 formula fed formula in the hospitals for those tummy problems of the infant, and it also has 98% lactose. All right, so this is our other Similac tolerance formulas that we also have in our tolerance line. Our Spit Up with added rice, our soy, which is an alternative to a milk-based formula, and then also we have our Total Comfort, which is sometimes a preferred formula for those healthcare providers that want a whey option.
Mm-hmm.
And so I want to just kind of ask, how comfortable are you recommending our Similac Sensitive or any of our Similac tolerance formulas, knowing all these great benefits that I mentioned today?
Very comfortable.
Okay.
Going to be good.
All right. So will you exclusively reach out to your closet whenever you're in need of a mild tolerance formula for those kiddos that are in need of something to control their fussiness and their gas?
I would love to, but it's up to the boss lady.
Yeah, doctor. What do you think?
So, just for my own kind of understanding of it, is the Enfamil products that we have upstairs, they do contain that palmolene oil?
Exactly.
And so
they
they're-
do. There is a couple on their line that they don't, but none of the mild tolerance formulas.
Okay.
Except one, but that's the progestamil. But other than that, they all contain palmolene oil.
Okay.
But
Well,
with
yeah.
our formulas, you'll be assured that your infants are going to develop those healthy bones and get that adequate
Right.
calcium which is needed for their bones.
And that's really what is important to me. I really want that calcium. So yeah, I would definitely go to sensitive because of that.
Thank you, doctor. I'll have your commitment and your accountability on that.
Okay.
Okay, thank you.
Bring me some more M&Ms and that's all. Just kidding. Just kidding.
All right, so moving on, what are you currently recommending for those more severe tolerance issues, like blood in the stool and like those colicky symptoms and protein allergies?
Nutramigen, yeah.
Nutramigen?
Mm-hmm.
Okay, what about Nutramigen is it that you like?
It's been around forever and it works.
Yeah, I like
Okay.
my rep as well.
Do you like
Rep,
Rep?
Yeah, he's been around for a long time.
Okay, are you familiar or have you used our Alimentum product?
It's in the cabinet, so I don't know if our other doctor, Aaron, he left though. He
I got
uses
him.
it.
I know what he does.
Does he use it?
Mm-hmm.
Okay.
Sometimes.
Sometimes, yeah.
If he's out of Nutramigen.
Okay, all right. So I'm here, as I mentioned, to share with you why I believe that our Alimentum is that choice, should be that choice option for you in your office. As I mentioned, it also has our unique dual carbohydrate blend. It has no palmolene oil. So, doctor, you mentioned to me that it was important for you to have those children grow and develop well with their bones and having that calcium. Knowing that our product does not contain any palmolene oil, and how comfortable are you recommending this product over what you're using currently?
I love that aspect of it because once again it was insensitive, so that's what I really liked about sensitive. Is there anything else besides that is beneficial in Alimentum?
Yes, we have a lot of unique benefits that our product has over what other hypoallergenic formulas that are out there. Our product also has 33% medium chain triglycerides. And so our products can be used as a protein malabsorption, also fat malabsorption. So
Okay.
when you do not know what the child comes in with and you suspect either or, like a protein malabsorption or a fat malabsorption, this is the way to go because this treats those two diagnostic criteria compared to the Nutramigen, which is only has that claim of protein malabsorption. Does that
Okay.
make sense?
Right, so it's basically you're knocking out two things rather than one.
Yeah, exactly. And another great thing is that we also have DHA and our ARA to support that brain and eye development. All right. And so another great benefit about our product is that it starts reducing those colicky symptoms due to protein sensitivity within 24 hours compared to what you're currently using, which is 48. And so here you can see a study done that looked at the comparison between the two. And so how does that make you feel, doctor? I know the
So-
other doctor left, so I wish I could have asked him what he thought, but
No,
what
I mean,
does
well,
24
actually,
hours even mean to
Right.
the rest of the office?
Fred, you deal a lot with the moms
Yeah, that's
when
something
they're
that,
complaining.
you know, I'm getting a phone call or, you know, if they're in person, they're upset, they're rattled themselves because, you know, they cannot get that baby to stop, you know, crying. So I think something with 24 hours is a lot better than 2 days, cause that extra day is just,
Yeah.
it's just rough.
You might
Yeah.
save
Let
them
me
a
ask
phone
the
call.
nurse over
That's
here,
right.
since you're the one that deals with the phone calls. What do you
Yeah,
think
so
24 hours would mean to your office?
24 hours in that phone call. 24 hours would be huge. I mean, if moms want to get to sleep, I think that can really do a lot for them.
Yeah. So now knowing all these great benefits of our Alimentum, how comfortable are you recommending this product to your customers, to your patients in need of that hypoallergenic product?
I feel pretty comfortable, yeah.
You feel comfortable,
Mhm.
doctor?
Yeah, I like the fact that you said it takes care of not only fat absorption but also protein sensitivity or that they have a true allergy. That's
Mhm.
huge, as well as saving Brad here a whole day sooner with the
That's
crying babies might help.
Alrighty, so you're right. I strongly believe that this product should be used for those children in need of a hypoallergenic product. We have a strong brand heritage behind our product. So we've been providing this formula for over 25 years. We have a lot of clinical evidence to support our findings behind why this product should be used in over 50 studies. And it's easy to find, it's widely available for those mothers that living in rural areas, and it's also WIC eligible. So I know sometimes here in the office, you have a large population of WIC, and so having that medical prescription can help that WIC mother get the product that they need. Alright, and so another great program that we have here at Similac is our Tummy Care Guarantee. And so this is a program that mom can use when she goes out, she's not sure what formula to use, and let's say, doctor, you recommend her a product,
Right.
and she, for whatever reason, she does not feel like it's right for her, and she switches, she can get reimbursed for her money. So do you think this is something that would benefit your mothers here in the office?
Now, is that any Similac product?
Exactly.
Okay. Well,
So
yeah.
if they
I mean,
switch from a term product, which is our advanced, to like, let's say a sensitive, and for whatever reason it doesn't work out for her, she can get reimbursed for her money.
Okay.
Alright. And so for baby sensitive tummy, please stay with Similac. As I mentioned, nutrition supports its products, and as a healthcare provider myself, I truly believe that these products are the best choice next to breast milk. Because at Similac, we do believe that breast milk is the gold standard for these infants. But sometimes, as we know, the mother doesn't want to breastfeed, she has a low supply, or she's going back to work, and she needs to introduce formula feedings. And so, do I have your commitment here today to recommend our Similac Sensitive and our Alimentum for those infants that are in need of that mild or severe tolerance issue? Okay.
I feel good. I mean, what do you guys think? I know you deal a lot more with the moms when they're coming in with these issues on the first.
Yeah, absolutely. I've enjoyed hearing what you had to say about the product, and I think it's a good product, and anything that can help me alleviate having to hear those babies cry an extra day would be great, and those
Yeah.
mothers.
Okay. And so, what do I need to do to make this protocol take place here in the office?
Well, we're gonna need a lot more samples.
I can definitely
And-
assist you with that.
So Alimentum is WIC eligible. We have some WIC moms.
And
Okay.
it's eligible in all 50 states, so you could definitely write that prescription to mom.
Okay. And do you have any coupons? I know Alimentum is expensive.
Yeah, I do have $3 off coupons for mothers that are in need. And then we also have our Pathway. I don't know if you were aware of it. It's a reimbursement program.
Okay.
And so they can go through that and see if they're eligible to, for those non-WIC moms, to get that formula paid for if they truly have a protein allergy.
Oh, okay. Cool.
Nice.
And so I can discuss that with you later after this meeting if you would want to.
Yeah. No, that sounds good. Let's do that.
Okay, so can I start removing at least the Similac, the Gentlease and the Nutramigen out of your closet today?
Does it have palmolene oil in it?
Exactly.
Get
They
that
both
out
do.
of my office.
Alright, so I can definitely do that, and I can stop by in 2 weeks and see how that's going here in your office.
Yeah, that sounds good. Definitely stop back so we can make sure that we have the right amount of samples and everything.
Okay, great. And then I just also want to assure you that I'm going to be your rep here, and I'm going to be coming often, and I can leave my contact information if you have any questions regarding feeding issues or you're low on samples. I can definitely stop by and stock your closet up.
Okay, perfect.
Okay, thank you. And then now if you want to count your numbers, I know probably.
Wait, I did it right. I've been eating them.
Good job.
How'd you feel?
Good. I felt comfortable.
Good, good. So what do you guys think? What did you do well?
Yeah, you seemed very comfortable up there delivering the information, and I mean, it was a smooth presentation. I think you did a great job.
Yeah, you presented all the information very well.
I also like that every time she was hitting on benefits, she wanted us to be the ones to say it. So I think that was nice.
I think that you present clinical evidence really well. You know your stuff. It's obvious. So.
Yeah, I like the tie-in that it kind of flowed through the whole thing, the creative idea, and then I put on here a clinical presentation. Let me see the clicker real quick. So the one thing, and this is gonna come in time as you guys get more comfortable, but I think it was on this slide.
Yeah, that one.
you had closed doctor for Alimentum, right? So then now let's start using the other slides to create the follow through. And don't feel like you have to keep going. So you know what? So as you recommend Alimentum, what do you need from me? And then then you just plug the WIC piece here. So what do you need from me as you're recommending Alimentum, doctor? Kind of going forward,
Wait, so she closed on the first
She closed right here
Oh.
for Alimentum.
yeah.
So now she had already closed you for sensitive and Alimentum.
Uh-huh.
And then, so just so you guys are kind of aware of this, like if I was in front of a doctor and I closed them and they said yeah, and then I kept trying to talk about the product, but they just said yes.
Oh,
Like
okay.
just
So
when
it's
you're in
where
the
she
field.
closed.
So yeah,
Okay.
don't let like the presentations make you feel like you have to
You have
keep
to go
presenting.
Got it.
So if you close here, that is like, thank you so much for your recommendation. You're gonna be just so excited because you're gonna see that reduction in crying time, which is clinically proven. In addition, it's also covered by WIC. So now knowing all that, like, what do you need from me to make sure you have enough resources to really pull them through? So don't feel like you have to let the slides go. And then also in part of the follow-up, when you're recommending these products to mom, just know that there is a tummy care guarantee. So I can bring you brochures of that as well. So just, and that's gonna come with just like knowing the slides, a little bit.
Yeah.
I mean, you did a great job
Oh, yeah,
moving
I
through it.
love
I mean,
the
really,
slides.
really good job
Thank you.
on going through the information and kind of getting those checking questions and all of that.
I think the whole candy thing helped me even ask questions.
I think it did too. I think it reminded you to ask questions.
And that's what I struggled in my
Yeah. Yeah.
place. So who gets the $5 gift card?
I don't know, I think that I took too many that I was supposed to too, so it's not, it was like 237. I was like,
She
Cassandra.
ate hers.
I know. Once she started eating them, I started eating them. I was like, oh, okay. All right, I'm gonna run to the restroom really fast.
Okay.
Figure out who wants to go next, and then we'll
Okay.
kick it back off.
Nobody?
Cassandra, thank you for that.
Yeah,
Cassandra
you
did
were
a
the
good job.
doctor that I.
Listen, I love coffee, so I'll take it.
It's a really
Cassandra has
pretty.
been great. Cassandra, thank you very much.
Lexi, do you
Yeah.
wanna go?
This is so fun.
No, mm-mm.